we are going to, perfect, we're going to start recording, and we're going to let folks into the meeting. Hello, welcome everyone. We are getting started a little bit late today, apologies. We are just gonna let folks trickle in here. I know we have people coming into Zoom, so we'll just give it a minute or two and then we'll get started. Great, looks like we are all here. So good afternoon, committee members and members of the public. Thank you for joining us. I'm Cody Ziegler, the Director of Statewide Policy here at the California Interagency Council on Homelessness, and I have the pleasure of opening our meeting today. Thank you all for your commitment in joining our efforts to prevent and end homelessness in California and for being with us at this meeting today. Just a few reminders as usual before we begin. This is a 2-hour meeting and we will do our best to stick to this time frame. Prior to this meeting, committee members were provided with a briefing packet, which is also available to the public on our website. We'll try to save time for the committee members to ask general questions toward the end of the meeting. But if we run out of time, please feel free to reach out to CalICH staff with any questions after the meeting. I do want to note for members of the public that this is the last meeting of the current advisory committee cohort. CalICH staff are working to recruit a new group of committee members before our next meeting, and we'll update the council on our progress. The second agenda item we have today will discuss this, so I'll wait until then for any more remarks on that. So we can move to the next slide, which is our agenda. So we will do our call to order, our tribal land acknowledgement and call roll. Then we'll move on to voting on our consent calendar. Our executive officer, Megan Marshall, will provide updates. And then we have two sort of main agenda items. The first is around Senate Bill 914. We'll talk about what that bill is and what the work CalICH has been doing to implement that bill. And then, as I mentioned, because this is the last meeting of this specific cohort of the advisory committee, we'll do a little bit of a wrap up, talk about what the future advisory committee is going to look like, and really look for your all's feedback on how to make sure this group is as effective as possible. Then we will move on to general public comment and adjourn the meeting. So at the end of today's meeting, there will be an opportunity for public comment. We will allow for a maximum of 2 minutes for each comment. We welcome all public comments and feedback. However, due to the structure of this public meeting, we may not be able to respond to them. So for this reason, if you have any specific questions that you would like answered, we ask you to please email us at calich@bcsh.ca.gov, and we'll put that email in the chat for folks. So with that, the advisory committee to the California Interagency Council on Homelessness is hereby called to order on May 7th, 2025 at 1:12 p.m. I'll pass it now to CalICH's tribal liaison, Vavila Blossoming Bear, to read the tribal land acknowledgement.
Thank you, and good afternoon, everyone. We wish to acknowledge that Sacramento is the unceded homeland of the Southern Maidu, Valley and Plains Miwok, the Nisinan people, the Patwin Wintun people, and members of the Wilton Rancheria tribe who have inhabited the landscape since time immemorial. We extend our gratitude to the ancestors of all California Native American tribes and their descendants, as we recognize that wherever we're joining from in our virtual community, we're all on California Native American land. Thank you.
Thank you, Vavila. Appreciate it. Now I'm going to pass it to CalICH staff member Claire Bannerman to please call the roll.
Great, thank you, Cody. So this is the attendance roll call for the advisory committee. We need a majority of members or a quorum to officially meet and hold this meeting. Committee members, after I call your name, please say present or here. Apologies if I mispronounce any names. Ludmilla Bade.
Present.
Al Ballesteros. Samantha Batko, Doug Bond, Carolyn Coleman, Joe Coletti.
Here.
Thank you. Charlene Demas Panado, Vitka Eisen, Jennifer Hark Dietz.
Here.
Thank you. Janet Kelly.
Present.
Thank you. Jody Ketcheside.
Present.
Thank you. Philip Mangano. Chris Martin. Mariah McGill.
Present.
Thank you. Luana Murphy. Elisa Orduña.
Present.
Thank you. Sharon Rapport.
Here.
Janie Roundtree. Emilio Salas. Reba Stevens.
Present.
Thank you. Megan Van Sant.
Present.
Thank you. Alex Bitzowski.
Present.
Thank you. Javon Wilkes.
Here.
Thank you. And Roxanne Wilson.
Present.
Thank you. Okay, we have a quorum and I will move us on to our next agenda item. Thank you. So this agenda item is the consent calendar. The consent calendar is for regular or non-controversial items that need to be approved by the committee via a vote. We have one item, the adoption of the or of the meeting summary for the February 5th, 2025 advisory committee meeting. Before proceeding, since this is an action item that will result in a vote, we will now open it up for public comment. Please keep comments to items on the consent calendar only. If your comment is not related to the consent calendar, there will be time for public comment at the end of this meeting. If you are connected through Zoom, please select the raised hand icon in the meeting window on your computer, or for those joining by telephone, you may press *9 to indicate that you would like to comment. Once I call you to speak, you'll be instructed to unmute yourself and you will have 2 minutes to make your comment. Okay. Any comments from advisory committee members? All right. Is there a motion to approve? There are no comments.
So moved.
Thank you, Ludmilla. Is there a second?
Second.
Thank you. Okay, so we have a motion to adopt and I will call a roll for a vote. As I call your name, please say aye or yes. You may also abstain or vote no. Ludmilla Bade.
Aye.
Thank you. Al Ballesteros. Samantha Batko. Doug Bond.
Aye.
Carolyn. Oh, thank you, Doug. Carolyn Coleman. Joe Coletti.
Yes.
Thank you. Charlene Demas Panado. Vitka Eisen. Jennifer Hark Dietz.
Yes.
Thank you. Janet Kelly.
Yes.
Oh, thanks, Janet. Jody Ketcheside. Philip Mangano. Chris Martin. Mariah McGill. Oh, I see, Jody, you've raised your hand.
Yeah, I'm still here. Sorry. Yeah, aye.
Thank you, Jody. Mariah McGill. Mariah, I know you were on here before as well.
Yes.
Oh, perfect. Luana Murphy, Elisa Orduña,
Yes.
thank you. Sharon Rapport,
Aye.
thank you. Janie Roundtree, Emilio Salas, Reba Stevens,
Aye.
thank you. Megan Van Sant,
Yes.
thank you. Alex Vitsotsky,
Yes.
thank you. Javon Wilkes
Yes.
and Roxanne Wilson.
Yes.
Thank you. The motion passes and the meeting summary is approved. I will turn it over to Megan Marshall for the next item.
Great. Thank you so much, Claire. Good afternoon, everyone. I'm Megan Marshall. I'm the Executive Officer for the California Interagency Council on Homelessness. Just a few updates to provide the advisory committee today. As many of you are aware, we at the Business Consumer Services and Housing Agency, which is the agency that Cal ICH is structured under, has put forward a recommendation supported by the governor's office to bifurcate the agency, splitting the agency into two, which would include the California Housing and Homelessness Agency and a Consumer Protection Services Agency. For those of you who've been around since the creation of BCSH will remember this was sort of, the general public and the legislature even sort of joked that BCSH was seemingly the island of misfit toys, sort of every department and any entity that didn't clearly fit elsewhere within agencies or within other departments sort of became what is now known as BCSH. Housing and homelessness continues to be the priority of this governor's administration, and whether whomever is our next governor of the great state of California will have no choice but to also prioritize housing and homelessness. So it makes sense to bifurcate and have a very clear focus at the cabinet secretary level on housing and homelessness, and certainly our colleagues in consumer services deserve that same dedicated focus. So with that agency, including our Secretary Moss, who's co-chair, of course, of our California Interagency Council on Homelessness, presented to what is known in California government structure, the Little Hoover Commission. And so that hearing took place on April 23rd and 24th. Thank you to folks who joined in and listened. It was definitely an experience, first in my time here as executive officer. But they continue to deliberate. They will make a recommendation to the legislature whether to accept the recommendation to bifurcate or to reject it. If there is nothing back from the legislature to the governor's office, then the bifurcation will take place on, I believe it's July the 6th of 2025. There are no significant changes that would, nothing that would majorly impact Cal ICH or our existing operations. The only mention and request for Cal ICH is that we be established as what Department of Finance refers to as a business unit, which is state speak for we would become our own department. There are no other changes that would come with establishing ourselves as an independent department. It just means that we are a little bit more deeply rooted in the structure of the state, which is definitely something that I would like to see. I know those on the advisory committee would like to see some more to come on that. But just wanted to share the first set of hearings have happened. There are additional hearings that are taking place in the assembly, I believe next week. So definitely more to come, but just wanted to give you guys a sense of the goings-ons with the Little Hoover Commission and the bifurcation of agency into two agencies. Next, I wanted to just touch on the federal update, the closure of the United States Interagency Council on Homelessness, or rather the dissolution of USICH. So while it's incredibly unfortunate, it will not impact the existence of Cal ICH or the work that we are responsible for in our California statutes. We will continue to press forward. We've gotten quite a few questions, some from advisory committee members, definitely from the general public, wanting to know how the closure of USICH will impact the work of Cal ICH. We will continue to press forward as the governor has asked us to do. So last but not least, I just wanted to give this advisory committee a sense of sort of the up and coming work for Cal ICH. On this being the last advisory committee meeting for this body. But we are, recognizing that all of the work that the state is responsible for takes place at the local level, mostly in our 58 counties, our big cities, most certainly our continuums of care. Cal ICH is starting to pay very dedicated attention and focus on the goings-ons in local communities, decisions being made by boards of supervisors, city councils, etc. And so just wanted to share two examples. I won't call the communities out by name. This is all public information. However, there was a smaller city that was that elected to not move forward with a letter of support and a contribution of $1 that would allow for the one public shelter in that community to remain open, although that shelter provider had been just recently awarded funds through the county. And so just highlighting that example because, when we talk about regional plans and we talk about, regions jointly applying for things and certainly having policies that are aligned locally, I think that is a very unfortunate example where that's not happening. A second example is, another, that was a small city example. I'll give you a large city example. We have a larger city who is contemplating a fee-for-service model for their, what they refer to as their congregate shelter programming, but it really is emergency shelter. And so it's something that we feel very strongly should not happen, certainly not something that we want other communities to begin considering. So Cal ICH has reached out to that jurisdiction in particular to offer our thoughts on their proposal and more importantly to offer thought partnership and alternatives that we would strongly suggest the community consider. So with that, I just wanted to highlight those three things. I do have quite a bit of speaking parts in this agenda. So with that, I'll just I'll wrap this up and turn it back over to, I think it's Molly Miller and Jeannie McKendry, if there are no questions from the advisory committee, I should clarify. All right.
I see
Claire.
Alex has his hand up.
Go ahead, Alex. Sorry, the lights just went off in this room. I just need to do a quick little dance to make sure they come back on.
No worries. Thank you for that update. Really helpful. And feel free to call those cities out by name. But appreciate that. I just wanted to know if is there, a couple meetings ago, or maybe it was last meeting, we had a really robust and fruitful discussion around some guidance that was being developed by Cal ICH on pathways to sober environments for folks within a housing first context. I just wanted to know if there was an update on that guidance or any next steps that we should be aware of.
Yeah, thank you, Alex. So it is still under review. I mean, I think folks on this call, certainly you know, but for the sake of those members of the public who have joined, Housing First is something that's, again, under the national microscope and making headlines. So with that, Cal ICH wants to be incredibly thoughtful about consulting with partners with expertise in recovery housing models. And so we're engaging with not just state folks, but local partners as well to ensure that the guidance document that Cal ICH intends to be supportive and tends to be a tool for communities who perhaps don't have as much expertise in this field. We want it to be something that's collaborative and not just done within the silo, although it's a great silo of Cal ICH. So we're still working on it is the very short answer, but wanted to give you some context.
I don't see any more hands from advisory committee members. So with that, we can pass it to our, oh, I do see a hand, sorry, Javon.
Yeah, just want to also appreciate the information and would love to know the communities that were just spoken of. One, for advocacy efforts to ensuring that one, we can all support, and of course on the youth side of things, make sure that we're aware of the communities in which we need to do additional advocacy work and collaboration.
Yeah, I don't think there's anything legally prohibiting me from saying these things, as I'm on public record, having given public comment in at least one, and we've recently made social media posts about the second. So, the first community is the city of Turlock, which is in Stanislaus County. They have one public shelter provider there that serves 49 mostly older adult males. But it is the one public shelter that exists in the city of Turlock. And so, Cal ICH as well as HCD has connected with Stanislaus County, who was the entity that had just awarded funding to the shelter provider. But part of the requirements there was for the shelter provider, if they were not in the unincorporated county, they had to have a letter of support from from their jurisdiction, which makes sense, right? Like you would want, if you're a funder, you would want the community wherever these projects exist to support. But I don't think anybody anticipated sort of what would happen as a result. I think it was over the course of, it was definitely 2 hearings. But I think it ended up being 3 hearings in total. So for a small city to hold sort of a program hostage in that way was very concerning. And the second city that is considering what I've dubbed as a fee-for-service model for shelter is actually the city of Sacramento. And so again, that's something that we have made connections with the city at the level of the city manager to express our concerns, request a meeting, but feel very strongly that has to be done in partnership with their regional partners as well. This can't just be a conversation with the city, who has developed a regional plan with the county with the continuum of care. So have requested that meeting take place and include county leadership as well as COC leadership. So. But in the highlights, I will say, we're also not just wanting to point, fingers and blame and all of that. There are some pretty incredible things happening in other jurisdictions as well. So I don't mean for this to sound like Cal ICH is on a mission to disparage cities and counties and COCs who are tasked with doing this work. We had a very hopeful conversation with folks from San Joaquin County, who are undergoing an evaluation of their shelter projects in a very unique way. They've actually hired an epidemiologist to do the evaluation. They've incorporated persons with lived experience. So I don't mean it to sound as if, as I said, doom and gloom. There are some tremendous things happening all across the state. So. All righty. Well, thank you all.
Great, so I will pass, yeah, thanks Molly, go for it.
Sure, thank you. My name is Molly. I'm part of the research team at Cal ICH. And today I and my colleague Jeannie McHenry from the local initiatives team will be presenting about Cal ICH's implementation of Senate Bill 914, also known as the Homeless Equity for Left Behind Populations, or the HELP Act. This is a bill that requires the state to set some specific goals to address homelessness among survivors of domestic violence, their children, and unaccompanied women, including a goal to decrease barriers to services and to promote cross-systems partnerships. So I will start by providing more of a background about the HELP Act, as well as an overview of Cal ICH's work to date. And then Jeannie is going to dive deeper into the barriers and partnerships that we've learned about through stakeholder engagement. And then we'll ask you for input on how Cal ICH can support localities in reducing barriers and promoting cross-systems partnerships through technical assistance. So now if we could go to the next slide. Before we start, we do want to acknowledge that discussions about domestic violence and surviving domestic violence can bring up strong emotions, difficult memories, and we encourage you to do whatever you need to do to take care of yourself, including pausing and taking a break if needed. And we honor your voice and your well-being in doing that. But we can move on to the next slide. So in 2023, over 69,000 survivors of domestic violence and over 94,000 women who are not accompanied by children access services in continuums of care while experiencing homelessness in California. And so to better meet the needs of these populations and to improve their inclusion in local and statewide homelessness planning and programs, the state legislature passed Senate Bill 914, also known as the HELP Act. And more about that on the next slide. So if we just move forward one slide. The HELP Act requires the state to set and measure progress towards goals to decrease the number, frequency, and duration of experiences of homelessness among domestic violence survivors and women not accompanied by children, who are referred to in the legislation as unaccompanied women. And that's the term that we're going to use in this presentation as well. It requires the state to evaluate goals at least every 2 years. The Act also requires the state to set a goal to decrease barriers to services and to promote cross-systems partnerships to expedite access to services, including social services, domestic violence services, regional center services, housing services, and mental health services. Furthermore, the Act requires the state to provide technical assistance to cities, counties, and COCs to support development of local programs and plans that address the needs of survivors, of their children, and of unaccompanied women. Next slide. So the definitions for the populations of focus that we are using are based off of the definitions that are provided in the legislation. So a very important caveat just to start with unaccompanied women is that unaccompanied women often have children that they don't live with, either because they are sometimes living with other family members, or maybe they've been placed in foster care or a number of different other situations. We can't measure that with the data that Cal ICH has currently, but it's just important for us to name that unaccompanied women can have specific needs related to their children, despite being defined here as being any adult woman who is experiencing homelessness in a household without children. Domestic violence survivors, that's defined as anyone who identifies as a survivor of domestic violence. And children of domestic violence survivors are any children under 18 who experience homelessness in a household with a survivor. So we can move on to the next slide. One of the reasons that the HELP Act focuses on cross-systems partnerships is that survivors of domestic violence often access services through organizations that are called victim service providers, or VSPs for short. So VSPs are organizations whose primary mission is to provide direct services to survivors of domestic violence. And that can include permanent and transitional housing providers, shelters, and other non-residential programs. And so this kind of gets to the question of why it's important to promote cross-systems partnerships that are inclusive of domestic violence services. Unlike other organizations that provide services and resources to people who are experiencing housing instability, victim service providers may not be fully integrated into every continuum of care's coordinated entry system. One example of this is that unlike homeless service providers that shared information about clients in their local homeless management information system, or HMIS, and that's data that the state also analyzes, victim service providers are restricted from sharing client level data with other service providers in their community or with HMIS and then with the state. So this restriction can improve survivor safety, but it can also sometimes be a barrier when survivors are trying to access services. Victim service providers do receive funding administered by the Governor's Office of Emergency Services, or CalOES, through several different programs, including the Domestic Violence Housing First and Domestic Violence Assistance Programs. And some victim service providers also receive funding from other state and federal programs as well. So far, CalICH has developed measures for the goals that are required by Senate Bill 914 by analyzing data from HDIS, CalOES, as well as some other sources, reviewing existing research, and through initial stakeholder engagements and formal tribal consultation, and by calculating the baseline measures for some required, for all of the required and most of the recommended HELP Act goals, which we'll go over in just a minute. CalICH is working on developing guidance for localities and state departments by currently surveying departments about how they are serving survivors and unaccompanied women, and also by continuing engagement and feedback sessions with local partners and tribes. And CalICH is also currently working on publishing goals and progress towards those goals by calculating the baseline measures for the goals that we haven't calculated those for yet. And we are also nearing completion of a public dashboard where we will show those goals and measures. And just an overview of the community engagement that I was referencing. So far we've had 3 focus groups with survivors of domestic violence, 2 with unaccompanied women. We've had 5 stakeholder engagement sessions with service providers and local administrators, 12 key informant interviews with 22 participants, including advocates, service providers, and other experts. And we have solicited 198 federally recognized tribes for formal tribal consultation. And we are engaging in additional efforts to engage tribal communities throughout the state. And those efforts are currently in the works. And then there have also been 3 sessions with CalICH's Lived Experience Advisory Board. So now to discuss more about the actual goals that are required by legislation. You can see goal 1, decreasing the number of survivors, their children, and unaccompanied women experiencing homelessness. Goal 2A is decreasing the duration of experiences of homelessness. Goal 2B is decreasing the frequency of experiences of homelessness. And then goal 3, decreasing barriers to services through promoting cross-systems partnerships. That is the goal that Jeannie is going to dive more deeply into in just a second. But in addition to the goals that are required by statute, on the next slide, we have some goals that were recommended through community engagement. So goal 4 is increasing the percentage of people exiting to permanent housing. Goal 5, increasing the percentage of people who moved into a sheltered setting after experiencing unsheltered homelessness. Goal 6 is increasing retention of permanent housing, and goal 7 is increasing financial stability. So we have already calculated goals 4 and 5, and those will be on the dashboard that I mentioned earlier. For goal 6 and 7, we're still assessing data and developing methods for measuring progress towards those goals. And now I will pass it over to Jeannie to dive more into goal 3.
Great. Thank you, Molly. Good afternoon, everyone. Nice to be with you all today. My name is Jeannie McKendry. I serve as the Director of Local Initiatives with Cal ICH. The Local Initiatives Division is focused on strengthening cross-systems partnerships, lifting up best practices, and serving as a connection to local communities. My team's role in the implementation of SB 914 includes soliciting feedback and input from stakeholders on Goal 3, decreasing barriers faced by unaccompanied women, survivors of domestic violence, and their children, through promoting cross-systems partnerships and to provide technical assistance to cities, counties, tribes, and COCs to best address the needs of this population. Through the extensive community outreach that Molly just discussed, we've gathered a list of barriers faced by these populations and potential solutions to those barriers, as well as cross-systems partnerships that could improve access to services. The 5 main types of barriers identified through these engagements include issues around shelter access and safety, access to services, staff training, discrimination, and lack of cross-systems partnerships. On the next few slides, I'll walk you through those barriers and recommended solutions. Next slide, please. So many participants talked about shelters not being physically or emotionally safe, and that there are not enough shelters that accept women without children, women with older male children, women with pets, or trans or gender nonconforming women. Solutions to these problems included providing greater oversight of safety in shelters, including providing a mechanism for people staying in those shelters to make anonymous complaints, adopting and enforcing rules pertaining to accessibility for all genders, providing in-depth training in trauma-informed care for all shelter staff, and increasing shelters and services that are available to women without children, women with pets, or women with older male children. Next slide, please. There were also a variety of barriers related to participants accessing services that were identified, including a lack of services or lack of information about available services for this population, difficult or re-traumatizing documentation requirements, such as requirements to provide a police report in order to prove that they were a victim of domestic violence, assessment tools that do not adequately account for the trauma and dangers faced by survivors, especially survivors without children present, and language barriers. Proposed solutions included creating survivor-centered online and in-person service navigation tools and resource repositories, streamlining referral processes, providing supportive wraparound services in more languages for longer amounts of time, reducing documentation and verification requirements, and providing assistance in gathering necessary documentation. Next slide, please. Providers lacking adequate training was also highlighted as a barrier, including providers not being knowledgeable about what resources and services are available to support survivors of domestic violence or unaccompanied women, and providers not being adequately trained in trauma-informed care. So the obvious solution to this problem is to increase the frequency and quality of training for providers, specifically around the needs of this vulnerable population. Next slide, please. A variety of types of discrimination were also raised as barriers for this population, including discrimination by landlords against people with vouchers or subsidies, landlords screening out people with poor or no rental or credit history, shelters discriminating based on citizenship or immigration status, and discrimination against trans or gender nonconforming people. Proposed solutions include hiring advocates to work with landlords and property owners on behalf of clients, providing landlord incentives, supporting clients to build their credit and rental history, incorporating job training and support as part of available services, and understanding citizenship requirements for work, benefits, housing, and services. And lastly, providing training and education in gender-based violence, gender identity, and intersectionality. Oh, I already got my next slide. Thank you. Cal ICH also solicited stakeholder input about cross-systems partnerships that could improve access to services and decrease barriers. Survivors of domestic violence and unaccompanied women often interact with multiple systems, including housing, domestic violence services, health, behavioral health, and social services. Therefore, collaboration and partnership between these systems is essential to ensure this vulnerable population is connected to all needed services with a focus on safety, stability, and equity. Key recommendations to strengthen and improve cross-systems partnerships focused primarily on information sharing and improving referrals and connections to multiple systems, including establishing or updating MOUs and data sharing agreements across sectors, case conferencing with staff across sectors, investing in joint training and cross-sector learning opportunities, co-locating services to improve access and coordination between different systems of care, and developing streamlined intake, assessment, and referral processes. This is not an exhaustive list, but wanted to give kind of the high level of most of the recommendations we got there. Next slide, please. Yep, perfect. So now we've kind of quickly covered the main barriers and potential solutions to those barriers. I'd like to discuss briefly the technical assistance that Cal ICH is in the process of developing to support efforts to reduce barriers and services and improve cross-systems partnerships to better support domestic violence survivors and unaccompanied women experiencing homelessness. Some of the TA tools we're creating include a checklist for implementing best practices across shelters, services, housing, intake, and assessment, resources to support cross-systems coordination between providers and community partners, and as Molly mentioned earlier, data dashboards that track progress and outcomes towards the SB 914 goals. Next slide, please. So here we are at our discussion point. I know we just provided you with a ton of information really quickly. Thanks for hanging in there with us. Now that we've discussed the materials Cal ICH is in the process of developing to be responsive to these gaps and barriers, we're really hoping to get your feedback on the best avenues for disseminating this information and any suggestions you may have for critical best practices that need to be included in these resources to best support Goal 3, decreasing barriers through improving cross-systems partnerships to better support domestic violence survivors and unaccompanied women experiencing homelessness. So I'm going to just quickly read through the list of questions on this slide and then open it up for any comments or suggestions. Please feel free to comment on any of these questions or provide any additional guidance as you see fit. So what topics are most important to include in the development of these TA resources? What's the best way to disseminate this TA to communities? What would support a successful rollout in your community? What are the best practices that you've seen work well in your community to support this population? And how should we measure a decrease in barriers or an increase in cross-systems partnerships? And with that, I'm going to open the floor for any comments or questions from advisory committee members. I've already got some hands. Great. You don't have I can't tell who raised their hand first, but in order of like how I read left to right here, Roxanne, I think you're first. You want to go ahead?
Thank you. One of the things that we struggle with a lot in our community is how to best serve people who are fleeing domestic violence through the coordinated entry system. And similarly, how are we protecting them in HMIS, because we do have non-victim service providers providing services, and so they don't necessarily fall under the VAWA Act. And they are allowed to put these clients inside of HMIS. So those are the types of things that I think we can really benefit from on our side.
Thank you so much. Janet?
Yes, somewhat in line to the last question, because I wasn't very clear on was this specific to DV designated shelter or housing, or just housing in general. And I could say, in looking at the presentation, none of that speaks to my community. None of it speaks to young people who are experiencing domestic violence or intimate partner violence. It doesn't speak to communities that have or are in areas that have some of the highest number of DV incidences and the lack of resources that are there that are not only culturally connecting, culturally relevant, but addresses issues that relate to other things such as gangs who control a lot of things that happen within DV, intimate partner violence, for those who are leaving or exiting out of sex and human trafficking. So there's a lot of kind of certain nuances that this doesn't take account of, especially when transportation becomes key and you can't cross through 3 or 4 different gang territories or trafficking territories or other kind of high violence, and I'm just going to put that in quotation, environmental territories, to where someone may say, I'll pick you up on such and such street, right? And then you're like, oh no, hold up, wait a minute, because you're really sending someone to a potential death trap. So, I mean, those things that I think need to be fleshed out a little more. I don't know, like, who was all in the sharing of their experience or feedback loop, but I really would hope that, one, you would engage young people. I would hope that you would engage people who come from communities that I say I know, that I have most familiarity or relationships with, so that that could also be incorporated in there too, because those could be two different things. A DV, shelter housing, as opposed to one in general. I mean, I could tell you where we've had instances where we've had to prevent not only bodily harm of a survivor, but also bodily harm of staff. And there's other nuances that come into that whole thing. So as a consideration, as you plan in the future, make sure that you get those voices in the feedback loop.
Thank you so much. Ludmilla?
Hi, so I'm not sure if this falls under TA, but but having some kind of a grievance system, or actually better than a grievance system, some way for the public, for the end users to safely share successes, suggestions, areas of concern or issues, or real problems, big bumps, and also to offer what they can do to help, like this, and have it be safely a place where that information could go. I keep hearing that I believe it's especially true for the public that this measure is addressing, but for all people who are experiencing homelessness, when they're in a shelter, there's nowhere that they can safely report these things without feeling that they're going to get consequences as a result of speaking out. And I also, and so, having it just at a state level, I think is too big a picture, but but having it just at the local level, where somebody could be identified because their issues are kind of known by, somebody is a service provider, is problematic as well. So some kind of way, and of thinking that through, as far as where could that information go to, what role or group of people could, I mean, a lived experience committee actually at the county level is a possibility where that information could go and be processed, but this needs to be researched. And I really, really feel that one of the big issues is we live in a culture of complaints and negativity and othering. And for that reason, I would like this feedback line to not just be for complaints. I feel that it's really important to capture the successes that we're having, whether those are, small or big or bigger. And to include people's suggestions and ideas, because some of us really know how to survive. We're quite smart out there, Definitely the issues, and also people's ability to help. There's people who can build a fence or paint a wall or help man the reception desk or something, and to hear what we're capable of doing to help gives us buy-in, gives us meaningful things, and will help overall really have a much better system with much better feedback and see everybody's dollars much better used. Thank you so much for hearing me.
Thank you so much. Reba.
So there's a few things. One is a need for more beds and ensuring that there are beds that are readily available. Bed seems in LA County to be decreasing. So how do we increase the access? Also, assistance with employment and childcare is critically important. But I also thought about bullet number 5. How do we measure a decrease in barriers or an increase in cross systems partners? And I'm reminded of what happens here in Los Angeles County with DPSF. So when an individual walks through the doors of DPSS unhoused, and we'll just use as an example a family, and perhaps that mother or father could be a victim of domestic violence. They are given 16 days in a hotel. And in that period, in that window, that 16-day window, they cannot, did you hear me? They cannot access another resource. So they cannot go to their lead agency shelter of or service unhoused service providers to seek assistance. So for instance, I'm just thinking about myself. If I was going to only get 16 days, I'm not waiting for day 17 to go knock on the door. I'm going quickly. I'm going quickly to get something more permanent from me and my children. But what's happening is you cannot access another service until it's exhausted. Now, when we talk about partnership, I question, can you clarify and define what partnership means? When we talk about barriers, I think we need to clarify and define what barriers mean. And too oftentimes, I'm always curious as to when we use keywords, do they really mean in the contents in which we're discussing? Because oftentimes it doesn't match. And so I think that one suggestion that Janet Kelly gave was around engaging with the young folk, particularly in underserved, unserved, or inappropriately served community, to hear from them. And then I also wanted to tap on what, always mess up her name, Mela, help me out, Solange. She said yes, around the feedback loop, right? So that we are hearing the positives, and you really want to hear it from the people that are being served. Even if it just said, thank you, oh, I got what I needed, anything. So I'm hoping that, whether I'm right, wrong, or indifferent and in line, I'm gonna keep talking about DPSS everywhere I go, because that is a huge barrier, and it's unfair to the participant, the family. It is utterly unfair to the provider, especially when that family has just walked out of the hotel room and now can qualify to utilize another service or resource, but they ain't got it.
Can I ask a quick follow-up question? Is that 16 days, is that like CalWORKS homeless assistance that you're referring to?
Well, I don't know if it's called CalWORKS homeless assistance. What I will say is that it's for families or individuals who are unhoused, where they provide a temporary, a voucher for a temporary stay in a hotel. But there is no connection to anything. And I'm glad you asked for a follow-up, because I have something else that I want to add to that.
Okay.
What we don't oftentimes think about is the pain and suffering that an individual has. Let's just take, for example, the mother. Perhaps now that we have a 16-day stay and we have a television set, and my young one is smiling and laughing again, and then we exhaust our time, it's exhausted, and we walk into another door, and now we're right back where we started from. And to see that smile change, when we talk about mental health, it's critically important that we think about mental health very broadly, because we don't think about how this affects the children's self-esteem and self-worth, and how are they actually looking at their mother, anyway, it's deep, and we need to go deeper. We need to stop looking at stuff from the outside and start really going inside, and start acquiring some lived experience, if you will, by way of being in it and holding someone's hand and walking them through the process so that you can feel it, smell it, and taste it. If this was our last meeting, every time I raise my hand, I'm bringing it real hard.
Appreciate all that. Thank you so much. Roxanne?
Thank you so much again. When I think about the question regarding cross systems collaboration, wherever it went, I lost it, but it was in here somewhere. I can't help but to always think about the issues that we had with the VSPs trying to integrate into the homeless sector. And it's beyond HMIS. It's the Housing First guidelines. Oh, it's so many things that the homeless sector has rolled out, and us trying to figure out how are we going to partner. They won't even talk to us about anything, really. They don't have. I think that we do need to address this HMIS issue. With 20% of the homeless population experiencing some level of domestic violence in their life, there definitely is room for improvement. They're asking for money from ESG, they're asking money from COC, but they don't even have the infrastructure to support reports. So I think that there does need to be a lot of help in that arena, because it causes so much tension between the COC world and the VSP world. So I just want to keep pounding that pavement about data collection. If we can't figure this out, I don't need to know everyone's name. I just need to know numbers. But we seem to always collide on that locally.
Hey, we've got lots of hands. Reba, did you want to finish a thought, or should I pick on some of the other hands raised and let you circle back to you?
Yeah, you can come back to me, but please do.
Great. Jennifer?
Thank you. I was just thinking as you were talking, and we are kind of a homeless service provider that serves multiple populations, but not a specific DV provider. But we do have some specific DV coordination within our site. And I just feel like it still sounds like we're setting up a complex system, to Reba's comments in LA, right? How do we, I guess my biggest thing, if we're looking at this from a statewide perspective, is how do you have early access? How do you have educational opportunities so people know about resources ahead of time? As opposed to, it feels like we always wait for the crisis. And I've been doing this for a very long time. And so it just seems like if we are trying to reimagine, that we should try to reimagine a customer service approach to people who are severely in need. And this is generational for most people, right? I know you talked about unaccompanied, but we know that most folks do have a child. So it feels like a cycle that we continue to build these systems around a lot of complexity. It's not very specific, but I would just say, how do we change that mindset and reduce the number of things that folks have to verify, jump through, and instead create pathways and work the human connection. And maybe there's an opportunity there to see some results.
Thank you. I lost the other hand. Reba, did you want to go ahead?
So there's a whole bunch. One is empowering empowerment for folks. And we don't see enough of that. What is how does one acquire self-esteem and self-confidence, self-assurance? It doesn't come by any of the services in which you provide unless we are, empowerment, breathing, relaxation, introducing people to wholeness and wellness, which is critically important. But I thought about in Los Angeles County, early childhood education for our school. And that is something that seems to have gone out the door, but we have a lot of children who are getting out of a car, out of a cubby hole somewhere, and they have to go to school. So what is that like for those children? I think that's critical. But I also wanted to remind us, because nobody talked about the federal government. When we talk about all these barriers, we got a whole bunch of barriers coming from the federal government right now, because I don't even know. I sit at the COC board, and I can't even tell you if the funding has been released. Los Angeles County, with all of its madness that's going on, it's turned upside down. And so when I think about the discussion that we're having right now, I am reminded of how uncertain and curious to know truly how certain many are about the direction we're going. If we're going in the right direction, what are those fears and how does it affect the services that are being rendered today as a result of what pressures that providers are experiencing? And then lastly, right now, let's talk about what's going on right now in Los Angeles County. My understanding is that providers are challenged with paying landlords to keep folks housed. That, and particularly, I know for certain of a few young families that are fearful today because of the uncertainties. So going back to mental health, oh, that's right, May is Mental Health Month. Being reminded of the conversations that we're having, are we having it to a point or to the degree in which we are really talking about reality of what's happening right now? Because I don't think anyone mentioned the federal government and what challenges that we're facing there right now. And those uncertainties are unhoused labor and our providers. I'll stop there, but
Thank you. Mariah?
Hi, thank you. I did just want to echo something that I believe Jennifer had mentioned, and breaking the cycle and really ensuring that we look at our children also and really focus on the youth. But one thing I wrote down during the session was, we focus on response, but we really need to also include prevention and recovery, and really ensure that we offer that entire process of support. We're so quick to say, put a Band-Aid on it. Let's stop it while it's happening. But then we don't think about, how do we prevent this from happening for the next generation? And how do we heal the DV survivors, whether men or women, right? Because we often forget that men are, in some cases, domestic violence survivors as well. But how do we heal them to move forward to create those healthy relationships? I wrote down, break cycles, build healthy relationships, heal community. So incorporating a holistic approach that not only looks at those three things, response, prevention, recovery, but also looks at culture, wellness, community building, youth empowerment, and really finding ways to support our survivors and prevent future DV as a community together. So thank you so much. I really appreciate the time.
Thank you so much. This is great. Really appreciate everyone's passion and insight on the subject. Really, really valuable. Thank you so much. Anybody else have anything they want to share? I know this can be a hard topic, so I just want to give folks another minute to gather their thoughts if they want to say anything or have any suggestions or responses to any of the question prompts on the screen. Okay, well, not seeing any more hands. I just again want to thank you all so much for your willingness to share and your great insight and your passion. Really, really awesome. Great to hear, and a lot of good suggestions in here. So thank you, thank you. I have one more slide. This is my last one here. This sums up our implementation of SB 914 kind of going forward. So during fiscal year 25-26 and beyond, we'll continue to solicit stakeholder and tribal feedback to refine SB 914 goals and methodology. We'll publish our dashboard with these goals and measures. As we just discussed, we'll be developing and disseminating technical assistance to support cities, counties, tribes, and COCs to decrease barriers, improve cross-system partnerships, and ultimately just serve this population in a better, smoother, more holistic way. We'll also be considering creating materials and guidance to support state departments, and we'll be updating the data on our dashboard on a regular basis. So those are kind of our tasks for the next year. And again, really, we will continue to be doing stakeholder feedback and really continue to engage with folks on this subject. So that's it for me. Thanks again for your time and attention. I will now pass the mic back to Megan, I believe.
Yeah, thank you, Jeannie, and thank you, advisory committee members, for all of your thoughts and input on, as Jeannie said, what can be an uncomfortable but very critical conversation. So not much of a segue, but moving to the next agenda item here, which is our advisory committee wrap-up discussion. Wanted to use this opportunity as this last meeting with the advisory committee as it's currently structured with this membership, have a conversation about future advisory committee configurations and onboarding processes. As a reminder, I think Cody said it, before we started this meeting, this body with its existing membership was CalICH's, and at that point in time was the Homeless Coordinating Financing Council, or HCFC. This was the first attempt at convening an advisory committee. Many of you were appointed by former leadership or connected through past secretaries, either Secretary Galley or Secretary Castro Ramirez, former secretaries, I should say. And so wanting to use the time that you've invested in this advisory committee, but most importantly, the work that you all do in your communities, whether it be LA County, who we heard quite a bit from today, or Monterey County, who Roxanne is here representing, wanting to hear sort of what would serve the best, what service could we provide to onboarding new advisory committee members, what connections can we establish at the onset of this new advisory committee. So more of a conversation, but before we get there, if we can go to the next slide, please. Just want to highlight perhaps for those members, but certainly for the general public, our conversation in the last advisory committee was about areas of expertise that are codified in statute, which are here, versus what we've recommended to our council, which they voted to approve additional seats of expertise. So just as a reminder for folks, there are areas of expertise that are codified in statute. They're listed here. I won't read them all, but I will emphasize, I will start with the first one. So a survivor of gender-based violence who formerly experienced homelessness. But you'll see there are 3 bolded items there, representative of local agency or organizations that participate in HUD's Continuum of Care program, 3 is partners with expertise and solutions to homelessness and best practices from other states. And the third bolded item there is a representative of committees on youth. And so this is a very large advisory committee as it's currently structured. It would be, I think, quite unfortunate if we lost all of our experts and those of you who are tremendously dedicated to this work. So we will be retaining 3 members that are codified in statute. And so those are the 3 bolded positions that you see there. And so those representatives that will continue on the advisory committee in the future structure are, as I mentioned, Roxanne Wilson, Alex Vodosky, and Javon Wilkes. And so if we can go to the next slide, please. The additional expertise that we recommended to the council and that they voted to adopt are listed here. I will just hit the highlights. This advisory committee did receive this presentation and we had quite the discussion, but this is just to serve as a reminder. But for example, and this was all used by incorporated feedback from you all, certainly incorporated feedback from members of Cal ICH's Lived Experience Advisory Board, as well as a deep dive into data analysis. And so in addition to what's codified in statute, what Cal ICH is required to have on the advisory committee, the council voted to increase seats on the advisory committee to include representatives from Northern and Southern California tribal communities, a representative from a committee or organization that specifically serves Native Hawaiian or Pacific Islander communities, a representative from a committee or organization that specifically serves family with minor children. And then I will jump over to that second column there, a representative from a managed care plan. And I will highlight an affordable or permanent supportive housing developer that serves people, persons experiencing homelessness. So in addition to what's required in statute, the council voted to expand the advisory committee to these additional seats. So very much appreciate the council's support in using data to inform the additional seats that we have on the advisory committee, because as data goes, things will change. And so at the end of this existing 3-year action plan to prevent and end homelessness, I'm sure the data will tell us a different story. And so whatever the data indicates at the end of the 3 years, the hope would be that the council would use that information to restructure the advisory committee so that it is as current as the needs of Californians. So with that, we'll go to the next slide, please. All right, so this is meant to be open discussion. I have no fear that this will be an awkward, quiet segment of the agenda, just judging by the great, robust conversation we've already had today. But we'll start off, I'll just read through and then we'll start off at the top. But hoping this advisory committee can help us understand what opportunities we missed, and by we, I take ownership of that. So what opportunities did I miss to make this committee more impactful? We can have a conversation of what it means to be impactful, if that would be helpful. Second question here is, where do you feel I could have made better use of your insights in specific areas of expertise? How can we improve the meeting structure to maximize outcomes? And last but not least, but what are critical components to include in the orientation and onboarding of new advisory committee members? Cal ICH is a lesser known entity for many partners, and so we're very committed in giving folks a robust informational there, but recognizing everybody is coming with their own experience, their own area of expertise, really wanting to have the conversation with you all. What are the important components for folks to understand about homelessness in California and the work that we have ahead? So with that, we'll just go back up to the top and open it up for responses from advisory committee members on what opportunities did I miss to make this committee more impactful. And I see Roxanne, her fingers going a million miles an hour, and I saw Janet's face, so I feel like we got some ideas percolating. So I'll just take a pause. Roxanne Wilson.
I was trying not to be the first one. I think that first of all, I just appreciate this, and I want to acknowledge that this has been an absolute pleasure serving with this committee and just building up the relationships between us. But I also want to say I'm such a worker, so I feel like one of the things that we really could have done more, even though it would have given us more work, is start spinning off into subcommittees and working on very specific target policy areas. So I feel like it was really high level in these meetings, and I am such a roll up your sleeves person. So I would love to see that in the next year as like focused policy areas.
And there's plenty of policy areas. We have, I think, no less than like 50 statutes that specifically, require Cal ICH to do one thing or another. So we're not short on that. But yeah, I appreciate the. So what I'm hearing is potentially the advisory committee taking a more active role in the working groups that we have. So, but focusing on policy. Yeah, I appreciate that. Yeah, and Jennifer, thank you for that, the comment in the chat there, bringing the group together in person to help build rapport. You know, the beauty of having the advisory committee structured the way it is that we have, folks up and down California, which is incredibly important, right? Like I take tremendous pride in that. Cal ICH's staff is also, as far south as Joshua Tree, as far north as, rural parts of, we have folks on our advisory committee in rural Humboldt. And that should be the case. The advisory committee should be reflective of the state and not specific to Sacramento. But then that makes it challenging to convene folks in one place. But yeah, that's not the first time we've heard of the desire to at least have a convening in person to establish that rapport. So thank you, Jennifer. All right, Alex, I saw your hand and then I started going off on a tangent.
Yeah, no worries. Thanks for the opportunity to give some feedback. I think with any like body, oftentimes it feels like the power within that body lies in whomever sets the agenda for the meeting. And it has sometimes, I think, felt like there's really important stuff happening around the state on homelessness. And we're talking about something else in this meeting. And I think there have been opportunities and have been moments where committee members have wanted to broach some of those items and give feedback to the state on some of those items. So I would recommend moving forward, like having some way to get feedback on what should be on the agenda, whether that's having, and maybe I'll talk about the structure, whether that's having like co-chairs that have the task of reaching out to the other members in between meetings to, gauge what they feel like they want to hear about, what they want to talk about. And just sort of having that agenda setting be more of a shared responsibility and not something that just comes kind of down from Cal ICH staff and, can box in the conversation a little bit.
Yeah, that's great. Thank you. And by all means, if the one less agenda we have to establish, that's we're definitely open to exploring. So yeah, thank you, Alex. Sharon?
Just first wanted to echo what Roxanne said, both of her comments, but wanted to thank all the staff of Cal ICH that, making it easy for us to participate, I think has been really helpful for us to be on these calls. I also, I think what Alex said makes sense. I think it would be really helpful to just have some sense that this committee is making a difference or is influencing, the direction somehow of the council, or is providing helpful feedback, because I feel like I'm not 100% sure all the time whether my comments or the participation of all of us on this group is influencing anything that happens at the council level or with the staff of Cal ICH, or what moves forward. And I guess, it might be helpful to either have like maybe a more realistic sense at the beginning of what this council can and can't influence. And maybe also, kind of like some feedback on like what, if there is influence, like where we have had an impact. And so I think maybe just reporting on that might be helpful for us to know. Or it might be helpful to say, like, this committee is advisory, and so you may not have like much sway on what ends up happening at the council or what the state, Cal ICH body does in the future. But I think it makes sense to have like feedback from you to hear what is reflected maybe among others, other advocates or others in the state level. So I guess I'm just like probably droning on too long about this, but just, maybe just to give people a better sense of like what this body really can impact and what it can't.
Yeah, and I totally agree with you, Sharon. I mean, I think you've been at a few hearings where I've presented now, and one of the things I start with is who just as important as who Cal ICH is who we are not, and establishing that almost immediately, because folks come in with their ideas or certainly their expertise. And we want to use this time respectfully and being very clear in where the lines are. And so I think, with respect to leadership that's come before, and certainly Cody and all of his team, this was sort of a pilot of sorts. It's in statute, advisory committee must exist, but this was the first attempt. And now that, we've got some years under our belt, and we have an official budget without grants, feel like this is the time to really solidify, cement things like the advisory committee, the lived experience advisory board. So yeah, very much appreciate that, Sharon.
Yeah, thanks, Megan.
Elisa?
Hi, yes. Just echoing I can't believe it's our last one. I'm just thankful for the scaffolding that we built and that for the state to hold this space. And it's been nice getting to know people from around the state. I would say, I guess it's kind of I don't know if it's a missed opportunity or just something kind of in hindsight, is how to use this group more like around briefings, particularly of statewide announcements. I remember, I think it was a year or so ago, and Governor Newsom was launching something and it felt like we were caught off guard. And not that everyone on here would agree, but at least to have been informed, we could have been, prepared for those local conversations. And I think of other topics like encampment solution or care court rollout or Cal AIM, or even the response to the wildfires. I feel like we haven't really had those conversations. So creating more maybe in between meeting topic specific briefings, so we're both educated. We know if someone asks us where to go to or how to, help make information accurate, as well as an opportunity for us to provide our own either initial feedback or what we're hearing at the local level. So I guess like as an ambassador and recognizing us as kind of these networkers, how can that be better leveraged, and how can we be more informed, knowing that we're leaders representing different constituencies? And the last thing I would just say is, I think this is kind of, it goes across, but related to the last one, is just, we talked about it, but we never had like full committee conversations, and maybe it's in the work group around our own understanding of different best practices, and particularly now around housing first, around equity, around harm reduction, because they impact communities differently. And it could feel like we're in disagreement or that we're not on the same page as with the value system. And I think we are, we just never had the chance to kind of unpack it, to see those topics from different perspectives. And I think that could have been helpful, especially as some of these are mandated in statewide funding.
Yeah, that's great. Thank you so much, Elisa. And I wrote down scaffolding. It will be something that I borrow and give you credit for using, particularly in hearings. So, but yeah, I agree that yeah, and and sometimes we're caught off guard, just being honest, myself as a governor's appointee. And I think folks on this call have gotten maybe like an 11 p.m. phone call from me, when Cal ICH had grants, last minute decisions, etc., which is not ideal, but the information is important, and being able to hear it directly from the entity that is supporting the work of the council, of the advisory committee. Yeah, I would definitely say those were missed opportunities, but appreciate the feedback. Ludmilla?
Hello. I've been so grateful and so honored to be part of this committee, and I've just learned so much being part of this, and I'm glad to have been able to help with some my perspective on things. And I'm sure I've annoyed some people as well at times, and that's good. If I wasn't doing that occasionally, I wouldn't be pushing it enough. So I do want to say one thing that I really see missing at this table is any representatives from the police department or sheriffs, okay? And I'm saying this because the police and the sheriffs are often on the front lines. They're very much on the front lines of interactions with homeless people. And they're sometimes caught between like a community push or orders to do something, and what they're seeing is actually really needed there in the community and with people in a homeless encampment or on the street. And it would be really wonderful to hear from somebody in the law enforcement community, which is different from the jail and prison system, okay? Because the law enforcement community is as you know, those people who go out and they're interacting with the public, and particularly I would love to see somebody who is maybe from a somewhat marginalized group themselves in the law enforcement community, would have a perspective. There's people who like from the LGBTQ people who are police officers and had to be and were stigmatized for many years, and they've come forward and they know what it is to be not in the majority. Somebody that is involved with community policing, the community policing models would be wonderful to have them. I'm not saying necessarily create a separate seat for that person, although that might be an idea in the future, but have a representative would be, and not hearing their perspective, I think we're really missing something. And okay, that's one point. Another is it would have been helpful to me to connect more with other lived experience people, like particularly when the lived experience kind of other advisory group came on board. I felt as a non-bureaucratic person who does have lived experience of homelessness, I know part of it is because maybe I didn't know how to reach out or didn't push to reach out, but I felt a little bit siloed or separate, and I would have liked to be able to sit with, for those of us who have lived experience, I would like us to maybe have it be where we could sit with the advisory committee. I don't want our voices to be too strong, but some way so that we can connect, so that if I'm thinking, gosh, I should really talk about this at the advisory committee, is that what some of the other people with experience are also thinking? Or, have an opportunity to kind of bounce that around with other people who are also in this place at that, helping to advise the state on this. Okay. Deep breath. Yes, several other committee members here have talked about having our input. Okay, this is actually having our input. I believe it'd be wonderful to have a space toward the beginning of each meeting, perhaps after the executive director's update, but for us to bring any kind of urgent or emergent issues from our area, and have those be mentioned. It's like, I'm starting to see law here or whatever, and just have those to be raised and heard, so that we can kind of think about that and seeing if we're getting what we're seeing out there in the real world in today that's happened since the last 3 months ago when we last met. And I'm going to say the problem I'm trying to fix there is it feels like we're moving at a really slow pace through the issues, which is as it needs to be, but to have it somehow more current, more urgent, more present, also to have space for those urgent and present conversations with some kind of time constraints on that. And that's actually one of the biggest challenges, is to keep that within a reasonable time. But to have a space for that. And then actually at the end, and I see other hands too here, is yes, to have some update on ongoing or upcoming legislation or government actions. I realize we can all follow the legislation stuff, but as a volunteer, I haven't had the bandwidth to do as much independent research as I would have liked to have, to follow what other issues are that are coming up through the legislature that you might want us to have, the committee might want us to have as input on, or for us to be aware of, so that we can help, offer the best solutions that we can, and contribute to that conversation. Thank you so much.
Yeah, those are great suggestions, Ludmilla. I will say, as far as additional seats on the advisory committee, we're going to keep it closed for these 3 years and just use this time to test our model and see if using data to really expand the advisory committee supports. I will say, like, connecting with, and not just traditional law enforcement, whether it's city police or county sheriffs, but other enforcement entities like code enforcement. Cal ICH is working, who are primarily responsible for towing and tagging vehicles that we have so many conversations about. Not necessarily to incorporate them at this point onto our advisory committee, but to introduce ourselves and introduce the work and ensure that they're making those connections locally. I'm sure folks on this call would not be surprised to know how many are unaware of who, what a COC is and who homeless service providers are in their own community. So it is something that Cal ICH is wading its way into that enforcement water. But thank you, Ludmilla. Roxanne?
Thank you. Just thinking about what Ludmilla had said about being alone, one of the things that we were really conscious of at the building out the COC is how it can feel that way, especially for persons with lived experience. So maybe it would be something that the LEAB appoints one of their own members of sorts to represent, and then they have that community. So that's just something to take into consideration. And then the second thing I would say is I would love for us to have the opportunity to help inform how NOFAs and RFAs roll out. Megan, I know you got an earful from me after HAP 6 came out. And I think that there's definitely opportunities. I imagine I'm not the only community that felt like that was a really big undertaking. And it also had put us in a position to where we are basically signing ourselves up to clear encampments in areas that are outside of our jurisdiction. So those are real things that I would love for us to have an opportunity to give comments on. We know that the state has done this before, because Home Key Plus was released a little bit early for comments. So I feel like that was such a huge pivot from HAP 1 through 5 that it would have been great for my colleagues and I on this group to provide comments on what that would look like locally.
Thanks, Roxanne. And Reba, if you wouldn't mind just 1 second before we get to your comments, if we can go, Josh, if you can take us to slide 30, just back one. So just wanted to highlight, something that Ludmilla had said, but also summarize comment in the chat. So we do have, and the council voted to approve 2 seats on the advisory committee for members from our Lived Experience Advisory Board. And so there will be sort of continuity between those bodies, and that we will have 2 members from the LEAB who are joining as advisory committee members as well. But also wanted to highlight that as far as our tribal communities are concerned, in the incorporation of those very unique perspectives and needs, we do have 2 seats on the advisory committee for Northern and Southern California tribal communities. So just wanted to offer those two highlights. Reba?
Yeah, let me first apologize for being off camera. My computer is really tripping bad. So I missed a lot of what was already said, so I may say some of the things that was said previously. But for me, it was the working groups. So when the working groups were formed, and that silo was bothersome for me, that we did not have engagement or connection to them. Another is, someone had mentioned it earlier, we never met in person. I don't even know what y'all look like. Who are you? And to me, that is so unfair, because we could have met centrally. I don't know. The other is around piloting. I was hoping that as an advisory member, that in our communities, being that they are different, that there could have been some pilots that we could have been able to, like for instance, with domestic violence, right? Just really touching it, and then coming back and bringing some information on our findings, and some problem and solution wise. So I think those were two of the biggest missing pieces for me.
Yeah, thank you, Reba. Roxanne Wilson is graciously offering stays in Monterey County if this advisory committee would like to to get. I don't think anybody would argue with a stay on the coast, but Megan.
I was sitting here thinking, okay, do I have anything meaningful to contribute to this conversation? And I'm not totally sure that I do, but I do want to pick up a little bit on, I think it was Roxanne's last comment. I honestly was reflecting, like, was my time well spent on this? Like, was this a waste of my own time? I mean, that was sort of the question I was asking myself. And I have to be honest, I'm not totally sure what the answer is. But I was struck by the concept that I feel like items came to us not at the right timing. Like Roxanne, I really would have loved the opportunity to weigh in on what HAP 6 NOFA was going to look like, because it's so ridiculous on so many levels. And that would have been a good use of my time. I think maybe it wouldn't have been taken up, but we could have at least said, so many parts of this are so burdensome, don't make any sense, are just making everything worse. So like there could have been that opportunity. Likewise, sometimes I felt like items came to us that was sort of the end of the deal, and maybe somebody was checking a box that they had to present it to an advisory board. So that's why they brought it to us, so that they could accomplish their goal of having shared it with an advisory body. But it was really kind of a done deal. And so I guess I would suggest for since you're asking, for future agenda setters to really think about the timing of an issue. If something's already done, don't bring it to us. It's okay. We'll hear about it in whatever forms it gets released in the future. But if there's actually meaningful input that could influence the final product, then it would be a good use of our time. So I think that would be my suggestion, that the timing of when things are brought to us could really make an impact on the usefulness of our input and how well we feel like we're spending our own time.
Yeah, I appreciate that, and thank you for your honesty. That was sort of the intention of the questions that we laid out here, is like, do folks feel like their time was well spent here? And I appreciate the honesty that you can't quite answer that question. I hope that's not the case for the next advisory committee. I hope that I offer enough support and infrastructure and clarity and roles that that they feel valued and valuable and all of those things. But appreciate the feedback, Megan. I mean, go ahead.
I will say, I mean, looking at the number, I mean, you added a lot of different new sectors, and it looks like a big committee with a lot of different perspectives. And I do wonder if that at the end of the day is going to benefit the committee or make things a lot harder. So without, again, really careful attention to how the agenda is structured, to whether you do work groups so that you're pulling together people with similar areas of expertise within that, it looks to me like a pretty unwieldy committee with almost too many perspectives represented. And again, I wonder if in an attempt to meet the needs of your larger committee who wants one of their people on the committee, you're going to end up with a committee that is going to be so diluted that their strength is going to be too diluted. That's sort of my thought. So I'll be
that's it.
honest, looking at a committee with that many different diverse perspectives, I feel like, oh, not sure that's a committee I would want to be on, but
Interesting that you say that, because it's actually a reduction of members. Like this, to me,
Oh, is it?
this structure is sort of almost impossible to move forward and like work product, because it truly was a matter of the former secretaries, like, here are the folks that I'm familiar with. Like
Right.
we have quite a bit of folks from LA, and a lot of that was Dr. Galley. And that's his prerogative, or was his prerogative as an appointee. But we felt like reducing the number, which is ultimately what the council has voted to move forward with, and to use data to inform which sectors we are asking to engage. We felt that would move us forward in sort of being able to produce things and to have this body focus on work products. So anyway, interesting perspectives from the two Megans nonetheless, but yeah, thank you. Reba?
Yeah, not sure if anyone talked about the large number of the inequities with Black folk experiencing homelessness across California. And if not, I think that it would be very beneficial moving forward to really address and make a change. It's sad, it hurts, it's painful when you're continuously having a conversation and talking about something that never ever changes. And it's never prioritized when it is a reality. The other is around death, the death rates of folks across California who are unhoused and dying. Is also another area. So if we're going to do something, let's go big. If I'm not mistaken, our governor terms out at the end of 2026. So here's a last beg. I'm begging to address what is in front of all of us.
Thank you, Reba. We got time for one more comment, and we'll give it to Ludmilla.
Okay, so one thing that would help on the timing, can you hear me? It's okay. Is to have something that comes out before the meeting, like for us to know what's going to be talked about on the meeting, and if there's any kind of input, so that we get that, so that I can run that by my homeless action committee or other people that I'm talking to locally, and then be prepared to kind of move forward with it rather than at the meeting finding out about an issue, then going to think about it, and then it's another 3 months before I could give that input. So if you give us more of a lead time before the upcoming meetings to be able to highlight in our minds what the issues are going to be, that could be the agenda if you have it, when possible. I know you've sometimes done that. Claire's been amazing as far as sending out stuff at times, but that hasn't always happened. And that would give us more time to run it by our committees and be and like locally. And if I could have a sense of what the timing is as far as when you're trying to complete something, so that I know if I'm going to give feedback, it needs to be in by a certain time, or that if I'm sharing with other people in my community that, oh, Cal ICH is looking at how do we figure this thing out, when that is. I would really feel that it's a much more meaningful part of that process if I'm being given the information so that I can give it to my people and then come back to you with more of a consensus. I feel like we'd be able to make more meaningful, get some traction and move forward more quickly. I hope that helps.
Yeah, it does. Thank you, Ludmilla. I think it takes us right back to clarity, right? Like establishing clear roles and defined responsibilities for the future committee. So appreciate that. All right, so I see Roxanne Wilson has her hand up. We will take last comment from Roxanne before we move forward with hearing from public comment. Go ahead, Roxanne.
I actually, it's about question number 3. I think we probably could increase the frequency of meetings.
Yeah.
Timing is an issue because we don't meet frequently enough. So if we were to increase the frequency, then I think it would also give us the opportunity to give comments while things are hot, not, as mentioned earlier, when they're almost complete.
Yeah, and we've learned quite a bit, particularly around the limitations, but also the flexibility of Bagley Keene, and when we can call a meeting, we can always call an emergency meeting if we needed to. And hope to not do that very frequently in the future, but it is something that we can certainly explore. So with that, I'll turn it back. Thank you all for your comments. We are going to be following up with a sort of an exit survey for those members who are not continuing with us. If you had any thoughts or suggestions that you weren't able to share, something occurs to you after this meeting, hope to hear from you back on the survey response. With that, we also have our next council meeting on June 4th. This is going to be at the Department of Education office in Sacramento. Advisory committee members are asked to please join. It is, as I said, in Sacramento, but if you happen to be in the area, you're so inclined to please join us for that in-person council meeting. If not, please join us virtually. For the first portion of that meeting so that we can officially recognize you all and you can hear from the council. We'd love to see you either on the screen or in person if you're available. So with that, I will turn it over to Cody.
Great. Thank you, Megan. And oh good, I'm glad that, oh no, this slide is hard to look at. I apologize for that. This was my doing. I just, I was sitting here listening to all the feedback, and I think something that struck me was that I think maybe 2 years ago when we started getting feedback like that from such an esteemed group of people would have been very intimidating and very scary, to say the least. And I think, sitting here today, I think it just speaks to the relationships that we've developed and that you all have helped develop in this advisory committee. It feels like we can always trust you to, as Reva said, bring it every meeting, right? We appreciate that you give us your honest opinions, that you tell us what you really think, because that's really what we're here to do. And of course, there's always more to be done to improve the way that the work is happening. But I think this is a group that has never existed before, and you all were really the people to pilot, as Megan said, this type of work. So we know it wasn't without its bumps and without its questions and difficulties along the way, but we just really appreciate you all for the time that you've put in here and the thoughtfulness that you've brought to this work. And we know it's a big ask to join these meetings and to lend us your time, especially as volunteers, especially when all the work you do individually is so meaningful, that 2 hours, even just 2 hours, is a lot. So just want to thank you all. I also want to thank the team at Cal ICH, Claire Vanderman and Giselle Sanchez, who were instrumental in creating this group and helping make it happen every quarter. So really appreciate your support. Can't say it enough. And for better or for worse, whether this is your last meeting or not, this is not the last time you will be hearing from Cal ICH. We will be in your inboxes. We will be asking for your feedback. We will be asking for your support. So just really appreciate everyone. And yeah, thank you for all the time. So with that, I will get off my little soapbox and I will pass it to Claire to facilitate general public comment.
All right, we will now accept general public comments. We welcome all comments and feedback. Due to the structure of this public meeting, we will not be able to respond to any questions. If you have any questions for Cal ICH or the committee, please email us at calich@bcsh.ca.gov. Everyone will get 2 minutes for their comment. A Cal ICH staff member will soon share their screen with a 2-minute countdown timer, and we will warn you when your time has expired. If you are connected through Zoom, please select the raised hand icon in the meeting window on your computer. For those joining us by telephone, you may press *9 to indicate that you would like to comment. And once I call on you, you will be instructed to press *6 to unmute yourself. Okay, great. I see our first hand raised is Ariane. All right, you have 2 minutes.
Hi there. Thank you so much for having me. My name is Ariane Dalladea. I'm here in Sacramento. As a woman, as an unaccompanied, oh, that's a hard one, woman with lived experience of homelessness, I really appreciate SB 914. And this bill will inform my advocacy focused on peer support, counseling, and empowerment to other women who, like me, became homeless due to loss of income and who experienced domestic violence and without any substance use issue. That's the problem. We always put in the bottom of the list because we don't have these ranking qualifiers. I would love for the committee to bring ways to fund projects or to, suggest or talk about ways to fund projects such as the one I am initiating. I'm right now connected with lived experience advisors in San Diego, but I am starting my own advocacy work here in Sacramento. And I really appreciate the advisory committee and Cal ICH work. It's been incredible. I love the way you guys work, and it's honor to be around you guys. Thank you.
Thank you. Okay, our next hand raised is Noah. All right, Noah, you have 2 minutes.
Hi, Noah Whitaker, Tulare County. This is sort of a point of general feedback because I've been joining these meetings remotely now for, I don't know, well over 2 years, I think. But what I've failed to see is the presence of the actual state departments. Cal ICH, to me, in its description, brings together the heads of different departments and things, but I haven't seen them in these meetings. I haven't seen them participating. I haven't seen them give presentations. Where's HCD? Where's CDSS? Where's Cal or HHSA? Where's CDPH, the Department of Education, Caltrans, the Rail Authority, the Workforce Development Board, and so many other agencies that are absolutely critical to approaching the issue of homelessness? Is each of these entities have major shares in this topic and issue. And I thought that kind of the point of Cal ICH was to bring these various entities together to collaborate, to coordinate, and to align on these efforts so that we can have uniform policies across all of our state agencies that then get pushed down to the local level for unified implementation. And that really seems to be lacking. And the local communities then are left to make sense of these different policies from numerous state agencies that are coming at us from multiple directions that often are outside of our own local area of expertise, agency, or organization, or beyond our reach to be able to affect change with things like the Rail Authority or Caltrans, where we really need their presence in this room to work through these policies in meaningful ways, and approaching issues like the HAP6 NOFA and application, which I agree with the other presenters is absolutely ridiculous. But if we had those entities at the table, we could have weeded through that at the state level. So that's my comment. Thank you.
Okay. All right, I see no other hands raised at this time. So thank you to those who provided comment. We appreciate your comments and engagement, and I will turn it back to Cody Ziegler for final remarks and adjournment.
Great. Well, I hate to adjourn, but I just really want to thank you all again for your time today. Your insights and your comments during our meeting are always so helpful and move us in the right direction. And as you can see, we're working hard to make this committee as impactful as possible. So, and we couldn't do that without your all's thoughtful input and attention. So please make sure to join us at our next council meeting on June 4th, 2025 at 1 p.m. The agenda for that will be up soon. The next advisory committee meeting with our new cohort is scheduled for August 6th, 2025. So please join into that as well. Would love for you all to get to meet those folks. Also want to thank members of the public who attended this meeting. And with that, the meeting is adjourned at 3:03 p.m. To receive up-to-date information on the council's activities, please sign up on the council's email list. You'll get emails about when our council meeting and advisory committee meetings occur. There is a sign-up option on the council webpage, and we encourage you to follow us on all of our social media platforms. So with that, I will bid you all adieu. Thank you all very much. Really appreciate all of your time, and feel free to reach out anytime you need.